Hey, Tina. So I just wanted to show you this.
Tina Campbell has fought tuberculosis herself and has worked in TB care for years. She's recently seen cases rise in the 33 First Nations communities she works with in northern Saskatchewan, from 19 cases in 2019 to more than 70 last year.
All of our resources, even my entire team, was deployed to assist with COVID.
Canadian health officials say the pandemic has hampered efforts to reduce and eliminate tuberculosis, a treatable disease that often affects the lungs.
And we are steadfast.
Indigenous Services Canada says contact tracing, prevention and diagnosis of TB were reduced in some areas as staff were redeployed.
All of those have contributed in some areas, either stalling of the progress made, or in some cases reversing the downward trend.
It may be that people did not seek healthcare because of the pandemic lockdowns, so we didn't diagnose them. It may be that people are mixing more.
In Manitoba, after years of declines, there was an increase in TB deaths last year.
Most of the gains we made with those 10 to 15% annual decreases were kind of lost in 2022, where we had a huge rebound.
TB has a disproportionate impact on Indigenous people, particularly among Inuit, with rates 300 times higher than the Canadian-born non-Indigenous population. Health officials say a lack of adequate housing, food insecurity, and limited healthcare access play a big role.
The good news is here they have a
Campbell sees that in First Nations communities too.
If you have one person with active TB in a 2-bedroom house with 20 people and all the windows are boarded up, it would be very likely that a lot of those people would become infected.
5 years ago, the federal government and the Inuit Tapirit Kanatami organization committed to eliminating Inuit TB by 2030. ITK says that goal is still possible, but says achieving it will require commitment, resolve, and funding from all levels of government. Alison Northcott, CBC News, Montreal.